And here we get to one of the largest administration tasks that you will have when you start to make treatment suggestions, and that is medical documentation. There are a ton of reasons to document, okay? I think it's about legal issues, it's about a memory aid, it's about allowing conversation between healthcare providers. It's required, it's ethical, it's all of these things. But specifically kind of in our realm, talking about modalities, not only is it something we have to do, it's something we should want to do because it helps us lay out our plan for our patient and being able to evaluate that plan. Okay, so laying out that treatment plan, everything that's going to go into that, all that shows up in the medical documentation, and that's the only place that all is. And so if we don't document well, it becomes really hard for us to track what we've done with this patient, follow up with patient outcomes, and reassess and be able to change effectively. So that's kind of the personal reason to do this. I mean, we get stuck in the we have to and it's required and it's the law and it's going to save our butt if we're sued and blah, blah, blah. But it's also just good practice for working with our patient. It gives us that realm to be able to plan things out and reflect all that. And we just need to make sure that that's all documented. The adage is, if it wasn't documented, it didn't happen. And again, that comes really from the legal standpoint of if you're pulled into court for a situation and you can't prove what you did, it's going to come back and bite you. So if you don't put it in the computer, if you don't write it down, it did not happen. And that can be detrimental to the patient and to you. Okay. Another kind of issue with medical documentation is what we call statute of limitations. And so when we start thinking about, well, how long do I need to keep medical records? We talked about this a little bit with patient confidentiality already, and it's state by state that has those rules. But realizing that whatever the statute of limitations is in your state, and by statute of limitations we mean how far back can an individual go for a negligent suit. So when is that time frame that they are allowed to pursue legal action up? Because if you're within that window, you want to make sure all your medical documentation is sustained. Okay, so whatever that is, state to state, you want to follow. The most important thing you can do is have legible, accurate medical documentation and medical records. The absence of those records is absolutely indefensible. You will be laughed out of court and you will be found negligent because you can't prove what you did. So it's really important to document everything. And again, when you're having goals, you have objective measures, you mark all that down, you mark down conversations that you had with the patient. Everything you do with this patient should be in their medical records. Again, they can be computerized or written. Computerized definitely makes storage easier. It makes transferability of knowledge easier. So especially in our realm where we could be on the road with a patient or out at practice with a patient, we can pull things up a little bit easier, things like that. So like I said, there's lots of reasons that we use medical documentation. Again, one was for planning. One is for continuity of care. So by documenting exam findings and the plan, especially when you're in a position where you have multiple clinicians that might be working with that patient in a healthcare environment, which is really where healthcare is going. It's going to this team environment where you have a group of different individuals that would all potentially work with this patient based on their levels of expertise in their particular areas in healthcare. So it could be multiple athletic trainers like it is, in a collegiate setting, or it could be in a clinic where you have nurses and occupational therapists and physical therapists and athletic trainers and physicians and speech pathologists and all of these people working together that would need to be able to understand this patient and what has happened with this patient. It also then, with that continuity of care, helps with communication among all those, as well as communication with the patients for all of those different individuals. And so again, any communication that happens between a clinician and the patient, between the clinician and the family, between healthcare providers about the clinician, all of that needs to be in their medical records. Treatment rendered and patient progress. So that really deals with the fact that, again, any interaction you have with this patient should be in their medical records. So their daily treatment, all that should include a date, a time, who the individual is providing the care, what the pathology of this individual is that's creating the care, the modality or exercises used or prescribed, the parameters used, what goals we were trying to treat with those parameters, were those goals met, any interview, re-examination, patient-oriented outcomes, all of that should show up there. What their current status is, again, we should re-interview patients between every kind of interaction and then make adjustments, make notes, make adjustments to the plans based on those interactions. Especially things like if you change parameters because of something that has occurred with this patient. You need to mark that down, again, to help not only with tracking what you're doing with this patient and being able to then say, okay, we've come on something that's helping meet our goals, but again, that continuity of care. It's obviously also a legal record, so it provides the staff, or kind of proves that the staff used reasonable care. So back to that negligence idea. It helps refresh the memories of the staff, especially if there is a legal case when you're going to have to testify. It will be used as evidence in those cases. It should reflect professional standards of practice. It should include any medical prescriptions and physician orders that occur, all of that. And then finally, it's also used for reimbursement documentation. So if you are going to be working with third-party payers, insurance companies essentially, they're going to request medical documentation, medical records of the patient, your treatment of the patient, and how that has reached treatment goals. So if you're not meeting treatment goals, they're not going to reimburse. So again, the idea of following up with your patient and documenting those things accurately is really important. So it really becomes on the insurance company. They're going to determine what's warranted. And that's not to say you can't do the treatment, but you're not going to get paid for the treatment. So you're not going to get reimbursed for the treatment. The length of the treatment, and what kind of, ideally that's based on evidence-based practice, but sometimes it's based on other things like financial issues and things like that. So sometimes you're limited to 6 treatments, even though research is saying 12 would be better, or things like that. So again, it becomes, what do you do for the patient? What is reimbursed? What do you maybe charge the patient for individually? Or what do you kind of eat as a clinician because you just know it's good practice and you're not going to get reimbursed for it. They'll compare the medical documentation to the billing that is produced, whether that's something you're producing or if you hire a company that does that. And again, they're going to want to see patient-based outcomes to help document the need for this type of treatment.